Thank you, Joe. In December of 1890, the Russian playwright and practicing physician, Anton Chekhov, wrote a letter in which he alluded to a long-standing observation that infections seem to slow the growth of malignant tumors. Neither Chekhov nor virtually anyone else of his time were in a position to know what to make of this, but William Coley found it to fuel a medical crusade. Cooley was a contemporary of Chekhov's and a bone surgeon at what is now the Memorial Sloan Kettering Cancer Center. Frustrated by the death of one of his earliest patients, he reviewed case histories of individuals with bone cancer and noticed that bacterial infections following a surgery seemed to improve the outcome. Knowing that infection stimulates the immune system, he reasoned that this might in turn lead to the destruction of cancer cells that have escaped the surgeon's knife. As a first test of this idea, Cooley injected cancer patients with living bacteria. That proved to be a rather bad idea. Then Cooley concocted a witch's brew containing killed preparations of 2 types of virulent bacteria and tried this brew on cancer of various kinds. He reported some remarkable successes, but the consigliere of the medical community were not convinced, and after his death in 1936, the use of Coley's toxin, as the brew was called, largely languished. It turns out that in principle, Cooley was simply ahead of his time. As medical science advanced, it became increasingly likely that cancer cells differ from normal cells in ways that make them foreign in the eyes of the immune system. So the question arose, could the immune system be aroused to destroy the outlaw cells? Thus began the modern search for an immunotherapy of cancer. Medical scientists spent decades trying to find various ways to awaken the presumed immune response to cancer cells. Occasionally, there were seemingly miraculous successes that certainly provided enticing fodder for the press, but overall, the results were disillusioning, prompting the sardonic mantra that, I quote, immunotherapy of cancer is promising and will always be promising. Now, a new player has arrived in the field and is a game changer. We owe its genesis to the visionary work of James Allison. Our immune system is a finely tuned apparatus. It has sensors that signal the presence of foreign intruders, accelerators that drive the response to the intruders, and brakes that keep things from getting out of hand, such as happens in autoimmune diseases such as lupus and multiple sclerosis. Jim Allison knew this apparatus inside out. He had isolated and characterized one of the principal sensors in the machine and had played a leading role in bringing the accelerators to light. Like others, he hoped that tramping on the accelerators might mobilize the immune response to cancer, a sort of latter-days version of Cooley's toxin. But in the sort of surprise that scientists lust after, Allison discovered that a presumed accelerator, a molecule dubbed CTL4, was in fact a brake, the first of its kind to be found in cells of the immune system. It occurred to Allison that disabling the brake might unleash an immune attack on cells, on cancer cells, and thus represent a new approach to the treatment of cancer. Within a year, he had encouraging evidence for his idea. Experimental impairment of the CTLA4 brake literally obliterated 2 types of cancer in mice. Moreover, the animals were thereafter immune to the same tumors. Allison then embarked on a torturous trek through the corporate landscape, seeking a partner to reduce his discovery to clinical practice. It was a tough sell. The immunotherapy was in disrepute, and there were suspicions that disabling CTLA4 might have dire consequences. After 2 years of frustration, Allison found a partner in the small biotechnology company Medarex, which deserves immense credit for gambling on his vision. By 1999, Medarex had developed a therapeutic against CTLA4, known originally by the dysarthric term ipilimumab, and eventually marketed as Yervoy. I've actually wondered about that name. It could be Yiddish, I suppose. But to my ear, it also has a ranch hand ring. In keeping with Allison's roots in rural Texas, where he was born and raised, Jim has not completely severed his roots. He still plays the harmonica and is jammed with Willie Nelson. They performed Blue Eyes Crying in the Rain. The dreaded cancer malignant melanoma has long been a favorite proving ground for immunotherapy because it appears to be especially provocative to the immune system. So Allison and Medarex chose that tumor for the first test of Yervoy's metal. It soon became apparent that they had struck gold. Even in the initial small trials intended mainly to assess the potential toxicity of Yervoy, ostensibly incurable tumors in some individuals simply melted away and never returned. The results were good enough to prompt the acquisition of Medarex by Bristol Myers Squibb for $2.4 billion, and Allison moved his laboratory from the University of California, Berkeley, to Memorial Sloan Kettering, where larger clinical trials could be readily mounted, and the ghost of William Cooley could watch over the action, with great satisfaction, I presume. As the clinical trials proceeded, it became clear that for many melanoma patients, Yervoy was a miraculous therapeutic. Individuals who had faced imminent death from metastatic disease were now surviving for years. Some of the earliest recipients of Yervoy are alive and well to this day, including Sharon Belvin, who is with us today with her husband, Rob. Sharon, where are you? There she is, yeah. At the time of her treatment with Yervoy, Sharon had melanomas in her lungs and brain. She has now been free of cancer for 9 years. Speaks for itself. In 2011, the Food and Drug Administration approved Yervoy as the standard of care for patients with otherwise untreatable forms of melanoma. The strategy represented by Yervoy became known as immune checkpoint therapy. Jim has a band called the Checkpoints, right? That term has been in the press of late because a version of the therapy is being used to treat metastatic melanoma in former President Jimmy Carter. Like most cancer therapies, Yervoy is not perfect. First, it's a nasty therapeutic with side effects that can be life-threatening, although these can usually be mitigated by skillful clinicians. Second, not all melanomas respond to Yervoy. We do not yet understand the failures and presently have no way to predict them. And third, it appears that only certain types of cancer respond to Yervoy, and that too is something of a mystery. But reinforcements are on the way, following the path blazed by Jim Allison. At least a half dozen additional immunological breaks have been uncovered and brought into play as therapeutic targets. The first to reach the front lines is a molecule known as PD-1, which is what's actually being used to treat, this is the target for treatment of President Carter. As with the CTLA-4 break, disabling PD-1 can have dramatic effects against melanoma and several other forms of cancer, but again, the response is far from universal. The good news is that disabling both of these breaks in the same patient often increases the response rate by a substantial amount, a welcome collaboration that is being pursued vigorously. There is also a hope that synergies will be found when immune checkpoint therapy is combined with the more established treatments of cancer, such as chemotherapy, radiation, and drugs targeted to the genetic malfunctions in cancer. Oncologists may soon find themselves armed with an embarrassment of new riches. The story of Jim Allison brings to mind a New Yorker cartoon in which the maitre d' of an elegant restaurant is on the phone. The caption reads, "Yes, Dr. Fortran, a party of 4 at 7 p.m., and you prefer the corner table. May I ask, are you a real doctor or merely a PhD?" That corner table apparently hung in the balance. The humor in this cartoon derives from an academic divide that makes the achievement of the mere PhD, Jim Allison, all the more remarkable. You'd get the corner table, Jim. It is a rare medical treatment, a scientist who makes a fundamental discovery and then propels that discovery all the way to a clinical breakthrough. That is what Jim Allison has done, and that is why he is receiving the 2015 Lasker Clinical Medical Research Award. Jim once described his motivation as, I quote, "the selfish desire to be the first person on the planet to know something." He has satisfied that desire in spades, and as a result, the planet promises to become a far better place for cancer patients. Bravo, Jim.